Hello and good morning from me, Benjamin Bonetti. And in today's video, we're going to be discussing the truth about Obsessive-Compulsive Disorder, also known as OCD. So OCD is a common and treatable mental health disorder that affects millions of people worldwide. It's characterized by a persistent intrusive thoughts or obsessions that create anxiety or distress. To relieve this anxiety, individuals with OCD may engage in repetitive behaviours or compulsions, such as washing their hands or checking things repeatedly. It's essential to understand that OCD is a medical condition and not a personal flaw or weakness. The disorder is caused by a complex interaction of genetic, neurological and environmental factors. It's not caused by a poor upbringing, personal weakness or lack of willpower. OCD can affect anyone, regardless of their age, gender or background. Now let's dive into some common misconceptions about OCD. One of the most pervasive myths about OCD is that it's just a quirk or a preference for cleanliness. However, OCD is much more complex than that. It involves a range of obsessions and compulsions that can impact every aspect of a person's life. These thoughts and behaviours can be distressing and time-consuming, interacting with daily activities and relationships. Another misconception is that people with OCD can simply stop their obsessions or compulsions if they try hard enough. OCD is a chronic and long-lasting disorder that requires professional treatment and support. Without proper treatment, the symptoms of OCD can worsen and lead to significant distress and impairment. There are several strategies that you can use to manage OCD effectively. The first and probably the most important one is to seek professional help. A mental health professional can provide proper diagnosis and create a treatment plan tailored to your specific needs. This might include CBT, exposure and response prevention, or medication. Second is to practice self-compassion. Remember, OCD is not a personal flaw or a weakness, and it's important to be kind to yourself. This can involve challenging negative self-talk and acknowledging your strengths and accomplishments. It's also essential to recognise that recovery is a journey and setbacks may occur along the way. Third is to learn about OCD and educate others. By learning more about OCD, you can understand your symptoms and find ways to manage them. Educating others can also reduce stigma and promote understanding. The International OCD Foundation is an excellent resource for information and support if required. The fourth is to practice relaxation techniques such as deep breathing exercises, meditation or yoga. These practices can help reduce anxiety and stress, which can worsen OCD symptoms. Mindful-based therapies also can be effective in reducing OCD symptoms. Lastly, develop a support system. Talking to trusted friends or family members can provide emotional support and understanding. Joining a support group or online community can also connect you with others who are going through similar experiences. Now, I'd like to encourage you to reflect upon your own experiences with OCD or any misconceptions you may have had about the disorder. Ask yourself how these thoughts and feelings are impacting your mental and emotional well-being. If you're struggling with OCD, take action steps to seek professional help. Practice self-compassion, learn about OCD, practice relaxation techniques, and develop a support system. Remember that OCD takes time and effort, but with proper treatment and support, it's possible to improve the quality of your life. Recovery is possible, and there is hope for a fulfilling life free from the constraints of OCD. It's not only individuals with OCD that are impacted by the disorder. Their loved ones and caregivers also play an essential role in maintaining the symptoms and providing support. If someone you care about has OCD, then it's important to educate yourself on the disorder and learn how you can support them. Here are some tips to supporting a loved one with OCD. Be patient and understanding. OCD can be frustrating and overwhelming, and your loved one may struggle with their symptoms. Try to be patient and avoid criticising or belittling them. Encourage treatment. Encourage your loved one to seek professional help and offer to accompany them to appointments if needed. Don't enable compulsions. Although it may seem tempting to give in to your loved one's compulsions to relieve their anxiety, this can actually reinforce the behaviour. Instead, offer support and encouragement to resist compulsion. Foster a supportive environment. Create a safe and supportive environment where your loved one can discuss their struggles and feelings without fear of judgment or criticism. Now, I'd like to encourage you to reflect on your own experiences with OCD or supporting a loved one with the disorder. Ask yourself how you can implement the strategies discussed here and what steps you can take to improve your mental and emotional well-being. If you're struggling with OCD or supporting a loved one with a disorder, remember that help is available. Seek professional help, educate yourself about OCD, practice self-compassion, and develop a support system. In summary, OCD is a challenging but manageable mental health disorder that can impact an individual and their loved ones. By understanding OCD, challenging common misconceptions, seeking professional help, practicing self-compassion, and fostering a supportive environment, you can manage your symptoms or support your loved ones effectively. So, thank you for listening to me, Benjamin Bonetti, and I invite you to visit my website, benjaminbonetti.com, or social media platforms for more resources on mental health and personal development.